This video will aim to outline the risks felines face in terms of canine attacks, the injuries that may occur, how to mitigate these injuries at home in the short term before the animal is able to be taken into a veterinary clinic, handling of the patient, surgery and pre- and post-operative care of a feline that suffered from an attack. Canine bite injuries are the most common form of trauma veterinarians encounter in feline patients. Although there are no official statistics on the rates in which canine feline related attacks happen, there have been many press reports on these matters. In the last 5 years, 270 canine feline attack cases have been documented, resulting in an 80% fatality rate. Despite the Animal Welfare Act 2006 outlining welfare of animals as the main goal, with endeavours to stop unnecessary suffering, and the Antisocial Behaviour, Crime and Policing Bill coming into effect in 2013, only 10% of these dog attacks have resulted in prosecutions, pointing to serious inadequacies in the application of these laws and regulations. While there are steps to mitigate infection and remedy attacks at home, a veterinarian should be contacted immediately when a dog attacks a feline. Veterinary advice should be followed whenever possible in the case of trauma. Canine bites in felines vary from small surface wounds to gouging lacerations and even extremity loss in extreme cases. Internal injuries are common in canine feline attack cases, therefore the full extent of the injuries may not be immediately apparent to the owner of the animal, so minimal intervention is advised. The initial reaction from an owner should be to cleanse any superficial wounds and reduce hemorrhaging, if applicable, to decrease the chances the laceration will become infected. Applying pressure with a sterile gauze to the wound is advised if hemorrhaging has occurred, with the gauze in a human first aid kit being sufficient if no others are available. Avoidance of anything that could be infectious is advised, such as kitchen towels or toilet paper, as these can be full of bacteria. A thorough body examination is required to establish the extent of the wound suffered by the feline, as this information can help the veterinarian later on. This can be done at home and must be handled gently to not exacerbate any wounds. Cleaning of the wound should be the next priority, with the antiseptic solution of diluted iodine or chlorhexidine in water being advised. The ratio of iodine to water should be 0.35 to 0.7 milliliters of iodine per litre of water. These antiseptic solutions can be purchased readily at drugstores and pharmacies. They should be relatively simple to find and administer to the feline. Abscesses may develop in the feline after a canine bite and may not be immediately apparent, so signs to look out for would be loss of appetite, lethargy, and hair loss. Rabies vaccinations may also be necessary if the feline has not recently been vaccinated for rabies, and quarantining will be beneficial, especially if there are other animals in the house. When transporting a feline with injuries to a veterinary clinic, it is important that the patient is properly restrained in a cat carrier and is as comfortable as possible. Handling the pet as little as possible is recommended, as overhandling when the feline is injured may cause increased internal bleeding, damage to soft tissue, and worsening of any fractures. Gentleness is required when handling of an injured feline. Covering the feline with a blanket or something they are familiar with can help them calm down. This helps with thermoregulation as well, but caution is advised if the animal has any open wounds that have not been treated yet. An old blanket could increase the risk of infection. Although stress may be induced in the owner, driving carefully to the veterinary clinic is advised, making sure the car makes no sudden sharp turns or heavy braking manoeuvres that may cause the feline to shift momentum and possibly exacerbate any injuries. A primary survey and prognosis of the feline patient must be undertaken upon arrival to the veterinary clinic with assistance from the owner's information of the canine attack. It is preferable that the owner relays as much information as possible to veterinary staff to reduce examination times, ensuring a quicker prognosis, but the veterinary staff must also perform standard examinations. Cardiovascular systems and respiratory systems must be extensively examined, along with full neurological examinations as early as possible. If significant hemorrhaging has occurred, then the feline may go into shock, and although shock is hard to determine in felines, an absence of tangible metatarsal or femoral pulse is a good indicator of hypertension and warrants immediate attempts to remedy the hypovolemia. The Dr. ABC method of examination should be employed for hypovolemic cases, which stands for danger response, airways, breathing and circulation. Dyspnoea is a common in canine feline attack cases, as dogs have an average bite force of 230 to 250 pounds per square inch and can crush large bones. So when this bite force is applied to a cat, their ribs can be crushed and respiratory systems can be compromised. Tachypnea, hyponopnia, and orthopnea are all breathing difficulties also found in feline trauma cases. Respiration rates should not be the only method used for examining thoracic respiratory trauma, as the readings are subject to human error and wounds inside the feline's body cannot be determined. Thoracic trauma should also be examined by radiography machines to get a detailed image of and the extent of the trauma. Immediate restraint or sedation is advised when radiography is used to examine the patient, and stabilization is necessary to ensure the stress of the restraint is reduced. X-ray images produced by the radiography machines not only show bones, but also show heart, lungs, and abdominal organs. Digital radiography is advised, as this form of radiography subjects the animal to 80% less radiation than film screen radiography. Neurological examinations also need undertaking, with mentation and voluntary motor functions being examined prior to the administration of analgesia. Debilitated mentation in felines can commonly occur in canine attacks cases and should also cause the veterinary team to be aware of raised intracranial pressure, ICP, along with brain swelling. Hypertension, abnormal respiratory patterns, and bradycardia are all signs of increased intracranial pressure. The priorities for remedying intracranial pressure are employing oxygen therapy, mitigating and reducing hypertension, and keeping the head elevated. In feline trauma patients, pulmonary edema and pleural effusion are prevalent. Felines that are diagnosed with inflammatory diseases have increased vascular permeability, heart dysfunction, and reduced colloid oncotic pressure due to hypovolemia. Fluid administration, always starting with isotonic crystalloids administered intravenously, is the first step in treatment. In felines, a bolus of 30 to 50 milliliters per kilogram of crystalloids and 5 to 10 milliliters per kilogram of colloids is recommended. Fluid excess is prevalent in wounded felines, therefore using caution when providing fluids is advised. Following the primary assessment, first aid and stabilization of a feline trauma patient, clipping the area around any lacerations is required, along with cleaning and flushing of wounds that may be found is necessary before any surgery can commence. Ensuring the oral health of the feline is stabilized is important for post-operative care for any fractures, pain or discomfort the animal experiences in the oral cavity may prevent them from feeding successfully and lead to anorexia and improper recovery. Anesthetic procedures of any animal carry inherent risks and are subject to human error and or staff incompetence. Client communication and veterinary staff competence are outlined as the main attributing factors to a successful anesthetic procedure. Client communication is necessary to ascertain any complications the feline may have had with anesthesia in the past, or any underlying conditions that could be aggravated by the procedure. An anesthetic plan must be put in place by the veterinary team in conjunction with the veterinarian, and this could outline the pre-operative analgesia throughout the stay at the veterinary clinic, and also include all phases of anesthesia. The medical history, physical examination results, age, breed, size, temperament, all need considering when producing a successful anesthetic plan. However, the same plan is usually used universally for felines to save time and allow for reduced stress in veterinary staff, and allows for comfortability with the anesthetic plan. This broad approach to anesthetic planning may aid in convenience but has disadvantages when it comes to an individual need of a patient. With the complication rates and mortality rates in anesthetic procedures being high in comparison with canine complications at 0.11% mortality rate compared to a 0.05 mortality rate in canines. An increase in personalisation of the anaesthetic plan could be utilised and would decrease potential complication happening. Anesthetically inducing the feline patient requires administration of mesotobidine and dexamdetomidine through an intravenous catheter or masked induction with breathable anesthetics. Intravenously administering the anesthetic drugs is recommended as there can be respiratory complications with using breathable alternatives such as a mask or induction chamber. A mask or induction chamber should only be used if a feline patient, if intravenous administration is not possible due to writhing patients or poor venous quality. A mask can also enable gas to escape unless airtight, so monitoring of the amount of anesthesia that is administered is difficult, along with the waste anesthetic gases that the veterinary staff are exposed to. Post-operative wound management is imperative in feline trauma cases as infections can be prevalent when a canine is administered several bite wounds. Antibiotics and pain medications should be administered pre- and post-operatively to mitigate the risk of infection and to alleviate pain in the patient. Amoxicillin, cephalexin, clindamycin, and enrofloxacin are all commonly used to treat infection in felines. Cephalexin will be the preferred option for mitigating infection as it has minimal side effects in felines. Opioids are most commonly used to alleviate pain in feline trauma cases, with codeine, fentanyl, morphine, and tramadol all being safe to administer. Wound management is the most important phase of post-operative care in feline trauma cases and can have high degrees of complexity. Lacerations that are induced by dog attacks can be difficult to manage, as there is often many different wounds that present themselves internally and externally. Complex wounds, as found in canine feline attack cases, can require multiple surgical operations and many different medical remedies. Extended recuperation times and large emotional financial investments from the owner is to be expected. Wound dressing and external coaptation are needed to mitigate further injury for feline patients and are relatively inexpensive and non-invasive. There is, however, a high probability of complications with any external coaptation or wound dressing in animals, as the animal's unpredictable nature may respond adversely. The Robert Jones bandage is still commonly used in veterinary orthopedics, and although it has its uses, it's often used inappropriately and for longer durations than is intended. The Robert Jones bandage is intended for the short-term reduction in soft tissue inflammation and to help stabilize fractures, but because of its elasticity, it is only effective for a day or two at the maximum, but is often used for longer. A publication on the efficacy of bandaging and coaptation in veterinary clinics found that 2 out of 3 animals that had undergone post-operative casting had mild to severe forms of soft tissue damage resulting from inappropriately chosen bandaging or coaptation. The statistics in Meeson's study calls for reform in the technique and equipment used in post-operative trauma care of felines, which would increase the welfare of the animals and create a more ethical post-operative situation for the animals involved. It is concluded that reform is necessary to protect felines from canine attacks, as protective laws are rarely enforced and bandaging and wound management techniques often leave the animal with soft tissue damage. Wound management, however, is important in the recovery success of any feline trauma case, and understanding the feline-specific needs in terms of veterinary treatments is necessary for a successful first aid.